Cardiac rehabilitation has been shown to improve physical activity, stop or reverse damage to your cardiovascular system, and reduce your chances of a second heart attack. I'm Stacie Lundquist. I'm the nursing coordinator in charge of cardiac rehab in Lindsborg Community Hospital.
Stacie, thank you so much for coming on the show. We're going to be talking about cardiac rehab today, in particular the program you have down at Lindsborg. Why don't you share with us about the program?
Well, we're really lucky that we have cardiac rehabilitation in Lindsborg. For a small facility to support that program in our small town is just wonderful. We get a lot of referrals from outside physicians. We get a lot of referrals from Salina Regional whenever we have a patient that's had a cardiac surgery or a cardiac event. They come to us and we start the rehabilitation program there in our wellness center in Lindsborg.
Okay, let's talk about the benefits of having cardiac rehab. What do the patients get out of it?
There's been so many proven benefits of cardiac rehab. They have decreased mortality rates after having a cardiac event. There's been studies that have shown that patients who go through cardiac rehab and graduate the program have a lifespan of 5 years longer than people who choose not to participate in cardiac rehab. They have increased activity tolerance, and they just do better overall in their wellness after cardiac rehab.
Let's talk about some of the details of actually what the patients do when they come in for rehab.
Well, rehabilitation is usually up to 36 sessions. We do it 2 to 3 times a week. Sessions last about 30 minutes to an hour. And as people come to cardiac rehab and they do their initial visit, we kind of get a feel of what their activity tolerance is going to be, what their education needs are going to be, and we try to tailor the program around them. So we might start them out on something like a sitting stepper and try to get their activity level increased, and then by the end of it we want them to try to be walking on a treadmill or doing a lot more activity than they came in with. We're always pushing people to do more during cardiac rehab because that is their safe environment where they are monitored and we can see what they can physically tolerate.
Let's talk about the process of how patients come to see you.
They're usually referred by their cardiologist or their cardiac surgeon or whoever followed them in the hospital if they had a cardiac event. I get the referral, we contact them, we offer cardiac rehab in Lindsborg 3 days a week from 1 p.m. to 3 p.m. on Monday, Wednesdays, and Fridays. And we have people that are local to our community, and we also have people that live on the outskirts of our community that prefer to come to Lindsborg. I even have patients that they work in the community, and it's easier for them to come into Lindsborg and do their cardiac rehabilitation during the day than try to go elsewhere. So we really have an outstanding program for our small community.
Stacie, thank you so much for some great information, and thank you for watching. For more information, please visit lindsborghospital.org and follow them on Facebook.